everyone. Welcome to my channel, and we will be covering all our important topics of BDS in this channel. हम इसमें बहुत ज़्यादा फास्ट फॉरवर्ड होके पढ़ेंगे एंड हम ट्राई करेंगे कि मैक्सिमम से मैक्सिमम चीज़ें हम BDS की विद इन वेरी वेरी शॉर्ट वीडियोस एंड सारे पॉइंट्स को कवर करते हुए एक एक चीज़ को पढ़ते हुए हम सारी चीज़ों को कवर करेंगे. This can be used for your revision and yes, like we all study one day before exam, so that is what we are going to do here. Okay, so let's get started. सबसे पहले हम anatomical landmarks पढ़ते हैं जो कि बहुत ज़्यादा important है हमारे वाइवा के लिए भी. Now, study of landmarks is very important. Why? So that we can differentiate between normal and abnormal structures to understand the stress bearing capacity of different areas. Now, anatomical areas क्या क्या होते हैं mandible के, maxilla के. So we are going to first cover about maxilla. So let's get started. Now, stress bearing areas होते हैं, relieving areas होते हैं, and we have limiting areas. Stress bearing areas means which areas can bear stress. Relieving areas means they cannot bear stress. These areas must be relieved while constructing the denture and they are not capable of bearing the stress. Next is a limiting area. They form the outer limit of the denture. Now let's come to the limiting structures. कौन से ऐसे structures हैं जो कि outer limit of the denture को हमारा prevent करते हैं. Like let's come to the labial frenum. Folds of the mucosal membrane present between the upper lip and the maxillary labial mucosa. ठीक है, तो हमें याद रहेगा labial frenum. That's a limiting structure. Okay, then there's the labial vestibule. Let's move forward. The next one is buccal frenum, and then after that we have buccal vestibule. Right? So we have all these structures: labial frenum, labial vestibule, buccal frenum, buccal vestibule, right? Now, posterior borders of maxillary limiting structures. Now, what are the posterior borders? Now, in the posteriorly, we have pterygomaxillary notch. We have an hamular notch, right? So, it is where is it? It is behind. It is behind the tuberosity, right? Between tuberosity and hamulus, there are what? Between the hamulus and the tuberosity, there are the pterygoid plates, right? Hamulus of pterygoid plates. Between tuberosity and hamulus of pterygoid plates, it is present. 2 mm wide, displaceable, resilient area it is. Now, so now we know one more structure over here. Let's move forward with our next structure, that is fovea palatini. What is a fovea palatini? It is 2 small glandular openings near the midline. Now, close to the vibrating line and on soft tissue, right? So it is posterior to the vibrating line, approximately 2 mm anterior to the fovea palatini. Now, what is fovea palatini? 2 small glandular openings, alright, near the midline. Now, vibrating lines of palate. Imaginary lines, there are some imaginary lines of the palate drawn across the palate and according to the motions of the soft palate to identify the anterior vibrating line and to identify the posterior vibrating line. Now, what do we do if I want to identify about the posterior vibrating line or the anterior vibrating line of the patient, right? So for the anterior vibrating line, I have to ask the patient to say ha, ah, ha. So it should be short, vigorous bursts like ah, ha, ha, ha. So these kinds of sounds when the patient is wearing the denture, okay, these will play a very good significance there. Now when we come to the posterior vibrating line, we again have to say the patient to say ah sound in a normal fashion. Now, we had some posterior structures. One of them was fovea palatini, the other were the vibrating lines of the palate, and there was also the pterygoid maxillary notch or the hamular notch, right? Now moving forward, we have some other structures, but before we actually move forward, let's understand about the cuspid bow shape. So cuspid bow shape, it's obviously the PPS which is having those shapes. So cuspid bow has anterior vibrating line and it also has the posterior vibrating line. Now, what is the significance of these two lines? So, anterior vibrating line, beginning of the motion of the soft palate. So, where the soft palate starts. Now, what is the significance of the posterior vibrating line? It denotation between limited movements and marked movement. Right? Just allow me a moment. I'm sorry for the inconvenience. Yes, I think we are going good, right? So we have got to know about a lot of limiting structures in the maxilla, right? Let's move forward now. Now, there is a soft palate. Now, there has been the classification given by House. Now, class 1, more than 5 mm horizontal tissue, ideal for the retention. Class 2, 1 to 5 mm of the horizontal tissue, angle where 45 degrees here. Okay, even if you don't give much significance here, let's understand the supporting structures now. So we are already done with the limiting structures. We are going to go ahead with the supporting structures. Supporting structures bears the vertical forces of the mastication. It bears the occlusal rods and stresses. So even when in exam, if you tend to forget what was the supporting structure, so we can just remind that okay, this structure supports, this structure has the ability to bear the forces of mastication, occlusal loads and stresses. So definitely it provides the support for the denture, or also known as the stress bearing areas. Now, support is obviously given by some hard palate and residual ridge. That's the areas, right? So hard palate, it is a primary stress bearing area, and that's an MCQ question. Now, next is the residual ridge. Now, U-shaped residual ridge plus the palate with moderate vault can give a good stress bearing area. Now, high V-shaped palate plus bulky ridges, right? So we can have bulky ridges, we can have U-shaped palate, and not flat palate with small ridges. So there are different conditions. Ridge ridges with undercuts. So their undercuts, they provide a good retention. Now moving forward, we have the other structure called maxillary tuberosity. This area is excellent for secondary support. It is long-standing supraerupted teeth, hanging tuberosity, right, will bring down the tuberosity along with it, and in this case surgical alteration of tuberosity is needed. Now we have palatine rugae, which are important for phonetics and prevents forward movement of denture. Now, relief areas of the maxilla. What are the relief areas? Those are not stress bearing areas and they have to be relieved. The first one is the incisive papilla. So, incisive papilla is between the two central incisors, right? So, that has to be relieved. Next is mid palatine palatal raphe. So, next is fovea palatini, zygomatic process. Okay, so we need to provide the relief to these areas. So that is for the topic.